Welcome to LangFort. I'm Dhanusha.
And I'm Aquina.
Today we are here with another role play about a concerned patient who has been scheduled for an endoscopy. Let's see how we can convince her about the procedure.
You have your cue card and you have 3 minutes to prepare.
Okay. How may I address the patient?
You can call me Jessica.
Okay.
All right, your time starts now.
Good morning, Jessica.
Good morning.
I'm Dhanusha, one of the registered nurses working in this hospital. Am I right in thinking that you are scheduled for the upper gastrointestinal endoscopy for acid reflux?
That's right.
Okay, Jessica. How do you feel about the endoscopy? Do you have anything to discuss in particular regarding this?
To be honest, I'm quite worried regarding this procedure because I really don't know how painful it might be.
Well, Jessica, I can see that you're quite anxious about the endoscopy. There is nothing to be worried. This is a very short procedure which takes only around 15 minutes. You'll be provided with sedation and a throat spray to numb the area. So you'll be feeling very less pain and discomfort. Did you get my point?
Yes, I understood your point.
Do you have any other questions?
Yes, I do have some other concerns. The thing is, I'd like to know what should I do in order to prepare for this procedure?
Well, Jessica, don't worry about that at all. I can definitely explain that. It actually involves very simple steps like avoiding solid food after midnight, and you can have liquids up to 6 hours prior to the endoscopy. Is that clear to you?
Yes.
Well, Miss Jessica, are you on any medications at present?
No, I'm not taking any kind of medications. However,
Okay.
I'd like to know why I can't have an early breakfast because, as you know, this endoscopy is scheduled for the afternoon.
Okay, Jessica, that's a reasonable concern that calls for an explanation. The problem is, if you have food or drinks, there is a risk of aspiration into lungs as you are sedated. This may lead to unnecessary complications. Apart from this, pre-procedure fasting is also necessary to get a clear imaging for a proper diagnosis. I hope you understand.
Yes, I do understand.
However, Jessica, you can have liquids like black tea, coffee, or even an apple juice for your breakfast. Will that be okay?
Yes, that sounds great. I'll have a black coffee then.
Okay, Jessica, do you have any other concerns?
Yes, I do have other concerns. The thing is, I'd like to know whether there will be any kind of risks to this procedure.
Jessica, it's quite normal to feel this way, but let me tell you, it's a very common procedure and there are very less complications. Moreover, you'll be constantly monitored by our expert team before, during, and after the procedure. And the doctor himself will address all your concerns and provide information before the endoscopy. Will that be okay?
Yes, that sounds very reassuring.
Do you want to discuss anything else?
Yes, I do have one more concern. I'd like to get an idea regarding the recovery period as well.
Jessica, usually patients make a very quick recovery and get discharged. However, as I mentioned earlier, you'll be having a very small discomfort in your throat. However, with adequate rest, that will be quickly subsided. Did you get my point?
Yes, I did.
And Jessica, it's also important to arrange someone to take you home following the procedure. You'll be having some drowsiness as an after effect of this sedation and the throat spray. So it is very important to have someone to accompany you home following the procedure. Will you be able to make arrangement for that?
Yes, I can do that. That will not be a problem.
Okay, Jessica, is there anything else you want to discuss regarding this?
I don't think so. I'm pretty much clear about what you just explained.
Well, Jessica, I'm glad to know that I have clarified all your doubt. And let me assure you once again that this is a very common procedure with very less complications. And our team will be monitoring you throughout the procedure. And I'm confident enough that you'll be making a very quick recovery following the endoscopy. If you have any more doubts, please feel free to contact me. I can help you anytime. Thank you.
Thank you.
Well, that was the end of our role play. As you can see, the patient had a lot of concerns that require tactful explanations.
So make sure that you're explaining everything tactfully to the patient so that the patient will be able to understand as well as be assured. So I hope this was helpful for you. We'll be back with another role play. Thank you.
Thank you.